I'm Dr. RMD, and today we'll be seeing how to solve MCQs in GTs or in your NEET PG without actually reading questions. We are going to use a new approach, a new scientific approach that is known as heuristics. Most of you, I think none of you have ever heard of this word called heuristics. This is a psychological term which actually means mental shortcuts to simplify problems and avoid cognitive overload. Now, why do you make mistakes in MCQs despite knowing that they are easy or they are silly mistakes? The reason is very simple, because you are going to solve 200 questions in that 3.5 hours, and there will be a lot of pressure overload in your brain. So your cognitive basis, all your cognitive functions will be halted for a moment. You will be entering a fog, a transient state, okay, where you won't be able to take a clear decision. And to create a shortcut in this, that is what is known as heuristics. So these are basically mental shortcuts so that you don't have any problem in assessing and analyzing information. Okay, so instead of going through all this way, you are going through a straight path, an easy path, and I'll tell how to use this to solve MCQs and what are the techniques. So I'll be giving some MCQs and let's see if you can solve them without actually applying these, without actually reading the question also. Okay, we'll just see at options and I'll tell you how to rule out options and how to go ahead about solving MCQs. Okay, so see this question. This was actually asked in INICET recent GT under Marrow. It was, I think, a mock test. So I just attempted it because I should know how students feel when mock tests are attended. So I should know what student psychology is. That's why I attended it myself. Okay, so now here you see there is a question about siraparantag, which is a new drug which is introduced, and the options are which of these is which of the following in which of the following toxicity it is not useful, which is not useful. Now, if you see all together, what a typical student will think is, okay, this is some new drug. I don't know for which condition it is used, but then you start applying logic. So here comes first rule of heuristics, that is, whenever you are presented with facts, always use your logic and you should deduce. You should come ahead with deduction. This is like just like Sherlock Holmes. Okay, you have to think something logical when you don't know answer. Now, I really don't know what siraparantag was, but actually I knew it because I had shot endgame videos, and in endgame pharmacology, I had also told about siraparantag. So those who have watched endgame pharmacology will actually be able to answer this question. So now you see heparin, dabigatran, rivaroxaban. Out of this, which is very odd one out? The answer is warfarin. Why? Because we know warfarin is actually used since old age, and then there is no specific antidote for it. And this warfarin, we give vitamin K. Okay, vitamin K is the only known antagonist. And what is asked in the question, if you note this, in everything, in the whole question, there is one key word which is of very significant, that is novel reversal agent. Warfarin is not a new drug. It's not. It doesn't need a new anticoagulant because we already have an antidote for it. Okay, we have vitamin K. But for this dabigatran, rivaroxaban, and heparin, maybe there are always something new coming up with heparin. So here the most likely answer seems to be heparin, warfarin, and that was actually the answer. So you are logically ruling out some option. This is known as logical deduction. Now coming to second option. See here, this is actually a very easy question, but you can make mistake. Right away, without even reading the question, I'm going to rule out option D, because everywhere else there is decimal. In option D, there is no decimal. So I'm directly going to rule out option D. Okay, it is none of my concern. Now I'm left out with 3 options. So there are total 600 students. Okay, so the denominator is 600. There is no doubt about it. Denominator is 600. But you want to see attack rate. Okay, in this attack rate, see there are 20 students who are not at risk. Basically, you're seeing attack rate. And when there is a small group which is not under risk, you are automatically going to exclude it, right? So your denominator becomes 580. Now, what is the attack rate? Means how many of them got gastroenteritis? There were totally 150 who newly were diagnosed. So 150 is there. Along with that, there were 30 who were already affected by another chronic disease. So it doesn't make any sense because they will also get gastroenteritis. So the answer is 180 divided by 580. So it approximately comes up to 25.8%. So this was the answer. Without even going in depth of the question, we understood the trick to solve this. Okay, this is called logical deduction. You actually use one logical clue and then you rule out other options. Okay, now we'll come to the second trick, and this trick is very helpful. See this. See, this is one drug, voriconazole, which is not frequently asked. It's an antifungal. Now there are 4 options in this. Now you'll see this and tell, sir, how to rule out. And I was also in the same situation when I was giving this mock test. I realized how to answer this without knowing anything. But there is something known as availability heuristic. What does availability heuristic mean? Availability heuristic means that this is the entire information, and this is the information which comes to the mind easily, which means there are some common things and there are some rare things. And in CYP enzyme, there are only 2 enzymes which are very important. One is CYP 2C9 and second is CYP3A4. CYP3A4 you will find everywhere. In every question it will be there. But CYP2C9 also is a part and parcel of, in many of your rapid revision notes or PTR you will find CYP2C9. But have you anywhere seen A6? Have you anywhere seen A1A2? Have you anywhere seen 2D6? No, right? But CYP2C9 is very common. So this is known as availability heuristic. So the most common ones are most likely to be the answer rather than less common ones. Okay. Now we'll go to third one. Okay, this trick is known as negative identification. So this question was very classic. This was also asked in mock test, and when I saw this option, I didn't even see what the question is. I just saw the end of this tube. I don't know what this tube is. I don't know the name of this tube is. I'm a pediatrician. I don't have any idea what this surgical instrument is. Okay, urological instrument is. And the question is, it is used in all the following things except, okay. And right away, my vision went towards, my sight went towards this fourth option, per urethral catheterization, which means you will insert through the urethra. Now, with the tip like this, can you insert in through the urethra? Just think logically, not possible, right? So this highest improbable answer is going to be the correct answer. That is known as negative identification, which means an option which is actually not at all possible in this situation becomes the answer. That is called negative identification. So directly by identifying this option, you are going to set aside all other options and you are going to mark this correct. Okay. So this is the third trick. Now, fourth trick is very common, and this is the reason why many of you will get more marks in the upcoming exam also. See this, match the following. Now just observe one thing in this. What this trick is, I'll tell you in a couple of minutes. Now just observe this fact. Among all the options, I'm not even going into the question. Among all the options, option A is there in everything. That means you strike out option A because it is there in everything. We are least bothered. Okay, so 5A, I'm going to strike out. I'm not even going to look at it. Next, option 4C is also there in everything. So I'm not going to look at that also. Option 1E is also there in everything. So I'm not going to look at 1E. Now, what are the two options that are left? One is infant mortality rate and there is fertility rate. Now, what is mortality death? So one is D. Okay. Sorry, 2 is D and 3 is B. As simple as that. This is known as anchoring heuristic, which means you use one specific point and using that point you will deduce rest of the options. So your main anchoring point here was this option 5A. So always search for that one particular option which is recurring again and again in all the options. That will be your anchoring point. Anchoring means supporting point, and using that deduction you will be ruling out other options. Okay. So this is a very, very, very useful trick for match the following questions. Now, this is one practice test for you. So out of this, which is the most common answer? So they are basically asking which are the chronic hypertensive changes. Okay. So one thing using anchoring deduction I can tell you is that anchoring heuristic is that option 1 is related to everything. So option 1 doesn't make any sense. It is generally there only. Okay. Now, if you see option 1 and then you see option number D. See, for a question like this, always remember this is a thumb rule. This has been seen in many probabilities that whenever you are given multiple choice options or to select multiple options, the one with all correct answers are known as distractors, which means examiners will purposefully put it so as to distract you from everything else. For a question like which are all the changes except or which are the following stable changes. Okay. So for such question, these distractors are common, and these distractors are the reason why you are going to mark this and you are going to get it wrong. Okay. Now, if you rule out this one option, then you are left with these three options. Now, what is very peculiar about these three options? I'm not even going into a question. You just assume that I don't know the answer at all. I don't know the question also. So among this, what pattern you are noticing is that 2, 3 come in one pair. So it is less likely that 2 and 3 both are the answer. So either 2 or 3. Similarly, either 4 or 5. So 2, 3 coming together doesn't make sense. So it should be either option A or option B. Now from nothing, from absolutely zero probability, I have increased your probability to answer the question by 50%. And this is called as rolling out option. This is just based on logical deduction and anchoring heuristic. Okay. Now this is one more example. See, you are a PhD, you are a medical officer in PhD, etc. I'm not going to look at that. Among these all options, what is very striking? One very striking is there are multiple options available, and this is known as option length heuristic. Okay, option length heuristic, which means the longer the option, the longer the sentence given in the option, the most likely is the answer going to be. Okay, so this is actually the correct answer for this. Now, let's see this option. See, here you have to actually predict which is the lowest for this test. Okay, lowest, which of the following is the lowest for the new test. Okay, so this is basically, this requires some PSM knowledge also, but you can actually solve it with logic also. So this is basically a logical deduction type of question. You just enter your logic and you come to the answer. Okay, so this is not very difficult. This is similar to the option that I discussed, techniques that I discussed earlier. Now, notice these two. These are very, very, very different topics. Why? I'm focusing on these two specific MCQs because, see, there's something called as Dixon's Q test, and these 4 things are given. I have no idea what these 4 are. Similarly, some contraceptive procedure is given and only names are given. I have no idea what it is. So why am I focusing on this? These are the exact questions which you shouldn't answer. Exactly, these are the questions which you shouldn't answer, because the probability here everywhere is just 25%. Okay, that is in a real world case scenario where probability is balanced. So there is no point in going ahead with this. Based on these names, how will I guess which procedure it is unless I know something regarding it? So I am not going to attend this question. Similarly, here also I am not going to attend. These questions are the ones which will cost you negative marks in your exam. So you should also be aware of that. That's why I have purposely put this in this slide. Now, see next question. Very, very, very tricky question. Okay, I'm not going to see anything else. I'm just going to see what the Philadelphia chromosome is best studied by which technique. Now, chromosome To what is the study of chromosome? It is karyotyping. It is given in karyotyping answer. So what is the answer? SKY, as easy as that. Okay. So these are like straightforward logical deduction questions. Okay. Next, very important, very common. This you can even a class 12 student, class 11 students also can solve this. See, what is the meaning of this? Oxidation. Next, oxidative deamination. What is the meaning of oxidation? You had studied this in your class 11th and class 12. Oxidation means either you lose hydrogen ions or you add oxygen ions. Okay. So in this, all this option, what is one thing which is common? Dehydrogenase. What does the mean? What is the meaning of dehydrogenase? It means you lose hydrogen ions. So this becomes the answer. Even if you don't know anything, still you can tick the answer. You can try your luck. No, now I have significantly changed the probabilities with which you get correct answer. Now, let's say you are attempting this same question in your MCQ app or in your coaching app platform, and you are not understanding what it is. Okay, you want more detail about it. Now, let's say there is no explanation provided, or you are not understanding the explanation. This is the most common reason why you go back to your main notes or main videos and you watch it. But that is time consuming. So alternatively, you will go to ChatGPT, but you are not trusting ChatGPT because sometimes recent guidelines are not given. It is not updated. And if you say ChatGPT is wrong, it will accept and it will tell that, oh, sorry, I was wrong. I just left it out. This is the new guidelines. So you can't entirely trust it. So you need a trusted authority, a trusted platform, a trusted easy source where you can solve this type of questions, what you don't understand. And during GT, it will be very helpful in reviewing. So I just went to this particular thing. I will not reveal the name now. I'll reveal at last, okay, at the last of the video. So I just entered the term oxidative deamination, and surprisingly, I got everything that is related to oxidative deamination, and I got the word glutamate dehydrogenase also. Going on to the next question. See here, a boy had some fracture and he has finally deformity. That is, he has difficulty in flexing the elbow, supining the forearm, and loss of sensation over the forearm. And out of these three nerves, now tell me using elimination basis, what options can you eliminate in this? Easily you can eliminate. See, till the arm there is separate nerve supply, and below the arm, below the forearm, there is separate nerve supply. If you have even decent understanding of anatomy, you know that median nerve, radial nerve and ulnar nerve, all these three supply below the forearm. Everything in the hands, backside, okay, everything is by these three nerves. And which is the organ out, which is the elimination out of this? It is musculocutaneous nerve. As easy as that. You don't even have to know anything complex, okay? Now, very important question, very interesting clinical question, okay? In HIV, when should ERT be started? Now, for a logical person, HIV, very aggressive disease, okay? In HIV, always we don't see anything, we straight away start the treatment and it is lifelong. So the most logical explanation based on logical deduction is start ERT immediately and continue lifelong. Now, I still have doubt whether this is the correct answer or not. So what I'll do, I'll go to this particular medical library of this particular app, and I'll go and I'll search HIV in pregnancy, and it will directly straight away take forward to me to this particular article where it is given clearly. And I was able to highlight this also, which is this platform, which is this app. I'll be telling in the upcoming slides. Woman newly diagnosed with HIV during pregnancy requires immediate ERT. No confusion, so option is third. Okay. Now, next one. Same related to HIV only, antiretroviral therapy should be initiated at. Again, a logically thinking person will think, what has CD4 to do with HIV? Nothing, right? You'll start immediately. So any CD4 count. Then I went to this specific app only and I searched same thing, ERT only I searched, and then I got acute HIV infection. Under that I got, and early initiation of ERT is recommended regardless of CD4 T cell count. So all my doubts are cleared. Next, see this particular question. Very important. This is exactly the reason why you should use this MCQ solving tricks, okay? So this is basically asking what is the amount of fluid to be calculated for burns, okay? Now there are two things straightforward. You can cancel out two options. See here, all these three options have same format, okay? That is weight into percentage of burns into a numerical formula. But you see here, weight plus 1500. What is this? This is something very different. So straight away it is out of option. Now we have two options. Now here it is into 2, here it is into 4, here it is divided by 2. So this goes out of option. So now you have only these two, either it is into 2 or into 4. Now from knowing nothing, I have increased the probability to 50%. So you might get or you might not get 50%. Now how to know whether you will get or not depends on what is the next step. So when I went to this medical library of this particular app, I went directly to burns. I scrolled down and I directly went to fluid resuscitation, and here it is given 4 ml into total body surface area into body weight. This is Parkland's formula. So I'll just tick this answer and it came correct. And if I have doubt regarding it, I'll go below and I'll see what is, okay, this is the fluid titration goal, what extra needs to be done, what are the etiologies, everything I'll get under one roof. So I don't have to just rely on explanation part of coaching app platform. I have some extra thing. So what this extra thing is, yes, you have guessed it right. This is nothing but UWorld. UWorld is one of the gold standard apps for preparation for USMLE. Now why I'm telling about USMLE preparation here? Because NEET NEET and INICET are moving towards clinical platforms. Okay, it is asking more of clinical scenarios. So if you see closely here, this is something known as UWorld Medical Library, where you can just search options. See here, if you just search burns, you will get everything related to burns in this, and you can just go through that explanation part, and you'll get a sense of concept clearing in this. This is the clinical medical library that I'm showing you. Okay, so this is UWorld Clinic Medical Library. Along with that, you'll have Qbank flashcards, and you can also highlight things in that particular app. Okay, so this is extremely useful for those students who are having difficulty when reviewing answers in GTs, or when you're solving Qbank or doing PYQs, you're not able to understand the explanation part of PYQs. So what happens is you end up going through to other sources, mainly main videos and unnecessary lengthy notes, which will actually be very time consuming. This will hardly take you 2 or 3 minutes to understand things. Okay, so if you are going to use this, the link is given in the description. Please go to that link, click on that link, and you can use coupon code RMD10, where you will get 10% discount on the purchase. Now this option is for you, this question is for you. Okay, so where does gluconeogenesis take place? So first thing, mature RBCs don't have nucleus, they don't have mitochondria also. So definitely they don't have anything related to gluconeogenesis. So this is straightforward out. Now adipocyte and myocyte both can't be the answer. Remember, whenever you see it talk about glucose, metabolism, everything, you will see muscle and adipocyte always comes together. Okay, it never is separate. So definitely these both are not the option. Then left out is kidney. So that is the answer. Now next option, you see, next question, which of the following is true about first order kinetics? Now there are 4 options. Okay, now how to answer such a question? Yes, the answer is not in MCQ tricks, it is basically in visual mnemonics. Yes, now many of you may not have known that I have conducted a series of pathology, pharmacology and medicine. Okay, all these 3 subjects, and next I'm going to go to microbiology, mnemonics for all these subjects. So entire pharmacology is completed in 6 hours. Entire pathology is completed in 6 hours, and entire medicine is completed in 10 hours. Okay, so this is example of what each page of endgame pharmacology video looks like. So here there is difference between 0 order and first order. I just brought it so that if you don't understand concept, just at least watch these 3 videos which are available on YouTube. Just go to the link which I have given below, and then you can click in on all these videos. Each video is just 1.5 hours, and within 6 hours you will complete one entire big subject. Okay, yes, so always remember, in MCQ you will have intuition, but intuition works only for one-liners, that is fact-based questions. For other questions you need logic. The best approach is intuition combined with logic, and that is what heuristics is. You are just making your path, your cognitive ability focused towards solving MCQs. So if you like this video, do share this video and also subscribe so that you get updates on regular videos like this. Thank you.